Hello, my name is Victoria Kress, and I am the coordinator of the Clinical Mental Health and Addictions Counseling programs at Youngstown State University. Clinical supervision is important as it helps to facilitate good client care. In this module, I will be providing information related to clinical supervision. More specifically, in this module, I will be discussing how counselor trainees and clinical supervisors can get the most out of the supervision process and maximize the value of their time spent together. This module was created as part of the Impacts Grant Program, which was financially supported by a grant Youngstown State University received from the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Clinical supervision plays a critically important role in a trainee's development. During the supervision process, counselor trainees are able to receive feedback that helps them develop their skills and competencies. They have an opportunity to grow both personally and professionally. Counselor supervision helps facilitate safe and ethical counseling practices, and it helps ensure compliance with professional and organizational treatment standards and practices.
Hi, it's Callie Capola, and I'd like to talk a little bit about my supervision experience today. As I entered the supervision relationship, I wish I would have known more about my supervisor's personality style and their professional style. I've had supervisors who are very timid and very outgoing, and I think there are pros and cons to both. But being in the middle of those two personality styles, I wish that I would have known more about their personality style so that we could have been the best match possible for clinical supervision. What kinds of things do I wish I would have known to ask my supervisor? I wish I would have asked my supervisor for some more continuing education opportunities that were more specific to my needs as a clinician. I know that there are several continuing education opportunities available to counselors, but with my needs specifically, I could have gained a lot of professional development if I would have focused more on what I needed to grow as a new professional, and my supervisor could have helped me to find those resources. I think that clinical supervision was helpful to me in several ways. One, it became an outlet for me personally. I was able to talk about my personal stress and really touch on some self-care that my supervisor was able to encourage, especially as a new professional. Another thing that I thought was really helpful in clinical supervision was the fact that I could check on some of the decisions that I made by myself and have that support with my supervisor. I always felt more confident after making a decision when my supervisor said that it was a sound decision, it was something that she would have decided herself, and that helped to really build my confidence too as a new professional when I would double check on some of my decisions. Another thing that I felt beneficial in supervision was the constant support that I had for some really uncomfortable ethical situations. Ethical dilemmas in counseling are really common, even minor ones like confidentiality, accepting gifts. All of those things I really felt supported in when I went to my supervisor and double checked because she had been there before in the past. I felt like utilizing my supervisor was not only encouraged in my graduate program, but it was encouraged at my agency. And I really never felt alone as a new professional because I had the support of a great supervisor behind me. There are things that I wish I would have shared with my supervisor that I didn't share with her. And some of those things were the areas that I really lacked confidence in. Specifically, I lacked confidence in mental health diagnosis. This is something that I didn't share with my supervisor to the fullest extent because I felt that she might have judged me if she knew how unconfident I was in this area. I was timid to share this because partly I was embarrassed and partly I felt that my graduate work should have educated me fully. But this was just an assumption, and I know that being in the field now as a new professional, I've learned more about mental health diagnosis from doing it rather than learning about it. So I wish that I would have been more confident and less timid on the lack of knowledge that I had. As your supervisor is also your boss, sometimes you really want to impress your supervisor, and that's the way that I felt. I never wanted her to feel that I was incompetent or that I shouldn't have been in the position that I was in, because when I really broke down and admitted some of the lack of confidence that I had in certain areas, I was met with support by my supervisor. So this was something that I learned early on, is to be honest, not be timid, and just ask questions. Most of the time, the supervisor probably went through the same thing when they were a new professional. One other thing that I wish that I would have done differently as a person new to supervision would be to bring my own agenda. A lot of times, both my supervisor and I were really busy. So I might not have brought an agenda and she might not have brought an agenda to supervision. And then we were both left with not a whole lot of productivity going on. As a new professional, it's my responsibility to take control of my supervision so that I can gain the most out of it professionally. I wish that I would have taken more initiative as a new professional, asked the questions that I needed to ask, and come prepared with those questions to supervision so that I utilized that hour to its fullest extent. Supervisors all have a lot on their plate, and so they don't have a whole lot of time to sit and not get anything done in supervision, and neither do you as a new professional. So I always felt that I should have been a little bit more prepared when I came to the supervision relationship with my supervisor. That's all. Thanks.
There are 3 primary types of supervision, and these include individual supervision, group supervision, and peer supervision. In individual supervision, a counselor or a counselor trainee meets individually with one supervisor. In these types of situations, a trainee is provided with an opportunity to receive a great deal of attention from one supervisor. In group supervision, a number of different trainees meet together in a group format and provide each other with feedback about their clinical cases. In a group supervision setting, a counselor is able to receive feedback from a number of different people and receive a great deal of diverse feedback. Peer supervision involves counselors or counselor trainees meeting together to receive support and feedback from their peers about their clinical work.
Hi, my name is Katie Cretella, and I am an intern in the Clinical Mental Health Counseling Program at Youngstown State University. Entering into internship and into the supervision relationship, one thing that I really wish that we would have learned not only in class, but also that I would have known to ask in the beginning of my internship was what was going to be expected from me out of the different departments. So I had interned at a detention facility, and I had to work with the magistrates, the probation officers, the corrections officers, and then any outside agencies that were providing AOD treatments or caseworkers, or even wraparound services. So really being aware of all of the different departments and agencies that I'm going to have to work with and what they're going to expect from me, and in return what I should expect from them. And working in any agency, you are always going to be collaborating and working with other individuals to better your clients and to help them be successful outside of treatment. So really understanding those relationships and how to foster them would have been really helpful because I didn't know that in the beginning of internship as to what exactly was going to be expected from me and what is appropriate to ask for that from them in return. Ways that I have used clinical supervision is during my supervision, we would really hone in on one skill that I wanted to work on and that I wanted to master. So, for example, one of them was using silence more and waiting for my client to really sit in their own thoughts before I responded. So I would use my basic clinical skills, but then I would also really focus on one skill that I needed to work on, and that really helped me piece together all of my skills to be able to master them. I think it was easier for me, at least, because I was able to focus on one at a time in order to, put the pieces to the puzzle together. And during supervision, we took it very slow and we discussed, how I would utilize that skill and what was bothering me about using it, or why was I afraid to use that skill. Some of the things that I wish I would have said or done differently in supervision is I really wish I would have been more open about my fears entering into internship. Having my supervisor watch me do intakes and just my regular counseling sessions, and then just to always have to supervise me, it was nerve-wracking thinking that I was under a microscope and that I sometimes felt like you're being judged because they are watching your clinical skills. So I was afraid, do they think I'm competent? Do they think that I'm really lacking in a certain area? So being more open about my fears and really being more confident in my role as a counselor would have been more helpful. There's not much I wish I would have shared with my supervisor, except for, again, I would have been more open about my personal fears, but fortunately my supervisor was in tune with my personality and some of my weaknesses as well as my strengths, so he really worked off of those to get me to open up more. As a student and also as a new professional, I will continue to use supervision in helping other counselors and then also helping classmates. As students, we all have areas that we want to work on, which will carry over into our professional careers. But during our tapes that we have to play during internship, sometimes it's scary knowing that your peers are going to be judging you, and when you go there and you find out that, okay, they're struggling with some of the same areas that I'm struggling with, we're able to collaborate and talk together about, what did their supervisor tell them and what did my supervisor tell me, and how can we really tailor those skills so that we're being the best counselors that we can be. I will definitely use that moving forward when working with counselors, or if I'm ever in the position where I get to supervise other counselors, is really providing that feedback, and then I think personally taking it slow and really mastering one skill at a time, because it was unrealistic for me to think that I was going to go in and have all these counseling skills and I could focus on every single counseling skill and slowly master them each session. So taking it slow and really focusing on your feelings as to what's holding you back, or why are you afraid of silence, and really exploring yourself in order to become a better therapist. So that was my experience during supervision. Overall, I had a great supervisor. I had a great internship location, and my supervision was excellent. I would not change a thing. I would just have been more open about my fears, and looking back, I probably wish I would have been more confident entering into internship so that I wasn't afraid to open up and be myself.
Clinical supervision provides counselor trainees with an important opportunity to develop knowledge, skills, and competencies related to counselor practice, to develop one's clinical style and expertise, to reflect on and receive feedback on the content and process of clinical work, to integrate theory into real-world practice, to explore the various ethical struggles and dilemmas that present in real-world clinical practice, to develop ways to manage stress and dealing with conflict in the workplace, to plan and use professional resources in an optimally effective way, and to reassure oneself and others that the counselor is providing high-quality care. An important function of counselor supervision is its ability to enhance counselor trainee reflectivity. Any good supervision should include a deepening of a counselor's reflective practices. Reflectivity involves an ability to reflect on and consider one's clinical practices and skills, one's strengths and weaknesses as a counselor, and how this information can be used in informing counselor practice. It also involves an ability to reflect on one's personal experiences and how this impacts their work with clients. Reflective practice also involves a deepened understanding of one's history and context and how this relates to their clinical practices. So, for example, one's culture, gender, family, spirituality, these are all very important in understanding who we are and how this impacts the work that we do with our clients. And finally, reflective practices should involve a deepened understanding of our personal characteristics and how they impact the counseling relationship with our clients. Supervisors serve in a number of different roles. First, they serve in a teacher role in that they teach and share information with their trainees. They also provide them with answers and guidance when they need it, and they use different supervision techniques and strategies to help supervisees learn the information they require to be effective counselors. Next, supervisors serve in a counselor or a facilitator role in that they help facilitate trainees' self-growth. They help them understand their personal reactions to counseling and to their clients. And they also help them learn how to manage the stresses associated with becoming a counselor. Supervisors also serve in a consultancy role in that they provide opinions and share alternatives with their trainees. They also collaborate with them on case conceptualization and treatment planning, and they provide them with guidance on various ethical situations. The supervision relationship is critically important to the supervision process. The supervision relationship serves as the foundation of the supervision process. A collaborative working relationship is essential if one is to have a successful supervision experience. As a part of the supervision relationship, counselors need to be aware and attuned to the relationship they have with their supervisor. Matters that should be considered include an understanding and building of trust within this relationship, an awareness of self-disclosure in the context of the supervision relationship. So in other words, it's important that a trainee feels safe within the supervision relationship to talk about things that they're struggling with or areas that they may feel vulnerable. Supervisees should also be aware of transference and counter-transference issues that may play out within the supervision relationship. They should also be sensitive to matters associated with diversity, appropriate boundaries, and always keep an eye to the power differential that is inherent in all supervisory relationships. It is important that supervisees are deliberate in how they think about and approach the supervision experience. They need to be aware of the aims and goals of supervision. They need to be in agreement with their supervisor about what they're working towards and make sure that they're on the same page. Supervisees need to be motivated to participate and they need to approach supervision with a positive attitude. Supervisees also have to be active in preparing for supervision sessions, and they need to really think about what it is they want to talk about and focus on when they meet with their supervisors. They need to come prepared. They need to ask specific questions of their supervisor when they meet with them so that they can get the most out of supervision. In general, supervisees need to make sure that they take responsibility for having a good supervision experience. Trainees also need to be deliberate in how they approach the group supervision process. Because there are a number of different people involved in group supervision, trainees need to be aware of all the different dynamics and how they can play out in a group setting. They need to be sure that they are listening and being respectful of all of the people's thoughts and feelings and experiences within the group setting. They need to make space to allow other people to share and to be honest about their insecurities and their vulnerabilities and the things with which they're struggling. When they're provided with feedback, it's helpful for trainees to be curious about that feedback and to not be defensive, but be genuinely curious and wonder what that feedback means and to make sure that they answer questions and get more information in detail as it's needed. It's important to be respectful, but in order to have a good group supervision experience, it's also important that everybody in the group feels that they can be safe and open with each other about feedback, even if that feedback isn't always positive. Sometimes it is the hard feedback that can be the most helpful to those who are participating in group supervision. As your clinical supervision relationship gets off the ground, it's helpful to take some time to get to know your supervisor and how he or she approaches their clinical work. Some questions that you might ask your supervisor include: what is your professional background and qualifications? How long have you been working in the field? What is your area of specialization? What is your current role in the agency? What are your special skills and professional interests? Have you had formal training in clinical supervision? If so, what form did this take? How long have you been a clinical supervisor? Some additional questions a supervisee might ask his or her supervisor include: what is your supervision style? What will you expect of me as a supervisee? What sort of supervision model do you prefer? Are you flexible in your use of that supervision model? What sort of conflicts have you had with supervisees in the past? How do you handle conflicts when they arise? How frequently do you have supervision yourself? What is the biggest mistake you think most supervisees make? How do you avoid burnout and compassion fatigue? There are a number of different things that trainees can do to encourage a positive supervisory experience. They can be open and flexible to the feedback that they get from their supervisor. So in other words, they can accept feedback they get, even if it's hard, and approach that feedback from a place of being curious instead of being defensive. They can also be aware of their needs and communicate these needs to their supervisor. So for example, if they're feeling overwhelmed with too many clients, they can ask their supervisor if they can receive fewer cases. They can also make room in supervision for honest self-assessment and reflection. And related to this, they can make themselves vulnerable and feel safe being vulnerable within the supervisory relationship. Another tip is that trainees can avoid self-blame. Self-blame and self-shame can be very unproductive in the counselor development process. So being aware of this and avoiding this, and instead being compassionate and patient with oneself, can be optimally helpful. Supervisees should also be prepared for supervision. They should stay active. They should also ask questions and utilize consultation from the supervisor. They should consider them a primary resource that they can pull on and lean on when they need feedback and support. There are a number of different things that supervisors can do to facilitate a healthy supervision relationship. First, they can work on developing mutual trust, understanding, and a spirit of collaboration in the context of the supervision relationship. Next, they can be active listeners. They can make themselves open and available to their supervisees. They can also aim to understand their trainees' hopes, struggles, fears, and worries. They can also understand the purpose and limits of the supervisory relationship. So, for example, they might understand when there are times that a supervisee may need to be referred to personal counseling to address something that is impacting his or her clinical work. They can also be fully present during supervisory sessions to communicate to their supervisee that they genuinely care and they take a strong interest in their personal growth and development. They can also be respectful, open, and honest with their trainees as appropriate, as this can facilitate a strong supervision relationship. They can also work on having a clear understanding of their own values, beliefs, and attitudes, and how this impacts the supervisory process.